So why should speech pathologists care about oxygen requirements and patients' overall respiratory status? Well, the more oxygen a patient requires, the more compromised their respiratory status. Research has shown that patients in at least moderate respiratory distress can be at higher risk for aspiration during swallowing. We will review normal breathing and swallowing patterns, then highlight the literature that shows how altered respiratory conditions can impact the swallow.
All right, we're going up to 50.
So I don't know if you can hear it, but you can hear it come out of my mouth when I open it, and I think I'm breaking the seal when I swallow because it's so much air that my nose pushes out the prongs a little bit, and it's definitely a lot harder.
And then we'll just do 60. This is the highest liters per minute. Is I guess we're at 60. It won't go anymore.
So you can hear the air coming out of my mouth now.
Next to her.
And my ears pop and the prongs kind of push away. And it's definitely pretty hard to swallow. So.
Okay, I'm going to turn it down. All right. And we'll turn it off.
So yeah, as you can see on that video, Rory subjectively was having a harder time swallowing as the flow rates were higher. When we started at 20, she didn't have much difficulty at all, though noticed a little bit of a difference. But as we reached that 60 liters per minute, she subjectively was having to put a lot of effort into swallowing and presumably protecting her airway during the swallow.
This tells us that the clinical swallow evaluation alone is not sufficient in assessing the pharyngeal swallow and determining appropriate diet recommendations for patients requiring high-flow nasal cannula. So what should you do when you receive a consult? The first thing you should recognize is that high-flow nasal cannula should not be an automatic no to a swallow evaluation. Instead, we recommend a thorough chart review, a multidisciplinary approach, and a good understanding of what the high-flow nasal cannula settings indicate. Remember, the higher the FiO2, the sicker the lungs. And the higher the liters per minute, or flow rates, the more tachypnic the patient may be. So let's talk about some frequently asked questions we receive about face masks. Can we just remove the mask to the side for our evaluations? If the patient requires high levels of oxygen and we are continually removing their mask for PO intake, we are depriving them of the oxygen they need to adequately ventilate. As already discussed, we suggest collaborating with the respiratory therapist and/or doctor to determine if the patient can be transitioned to an oxygen device that would match the patient's respiratory demands, but also allow us access to their mouth. What about putting a straw through the side ports? The side ports are the little holes on the side of the face mask. An SLP completing a swallow evaluation by, quote, putting a straw through the side of the ports is not comprehensive or sufficient. In these cases, we would again request the patient be transitioned to a non-masked device. If this is not possible, we would defer to the medical team. What if they just want us to check for meds? There are cases where the risk-benefit of aspiration versus not being able to take an essential medication should be weighed. This is a case-by-case basis and should be discussed with the medical team.